matter is we are all subject to our hormones. We're subject to our hormones as teenagers. We're subject as adults.
How about mental health? People have mood swings.
Mood swings may also just be your natural feelings. It can also be due to hormones. It can be a mix of both.
Some people get acne, in their late 40s.
You're maintaining muscle mass less.
So we can also, go back and blame them, right, for any mood swings. It could be they are also hitting menopause, we can always say.
You will all of a sudden be like, why do I look older?
So do you agree that supplements help? Like collagen rings and capsules and tablets?
Some celebs' faces you love, right? So everyone just focuses on the celeb's face that they don't like.
How menopause and those hormonal changes impacts our daily lives, mental health, and so many skin-related issues. Joining me today is Dr. Kiran Sethi, who's a renowned dermatologist. She has shifted her base from New York to New Delhi. She's on speed dial of Who's and Who of Delhi. She wears many hats. She's a mother, author, and a very popular TV anchor. So, Dr. Kiran, welcome to the podcast. Today, we'll be discussing on a very sensitive topic, and I think we should talk more openly about it, menopause. So, what is the difference between perimenopause and menopause?
So perimenopause, you're still getting your periods, you're still getting menstruation. They may be a bit irregular, they may be changing, but you are still getting your period. Menopause is classified by the cessation of menstruation by longer than 6 months. So you've stopped getting your period for at least 6 months, and that's menopause. That's
And
it.
how soon it starts, like perimenopause?
So perimenopause can start for some women earlier. It can even start in your late 30s. Usually it's in your 40s, late 40s, and then typically menopause happens in your 50s. But we do see more and more reports of early menopause. So it's something to watch out for and pay attention to.
So you mean perimenopause is irregular periods, right? Irregular menstrual cycle?
Perimenopause doesn't have to be an irregular menstrual cycle. You can have soft signs of perimenopause, which may be more irritability. You may have some hot flashes. You may be more insomniac. You may, just have different moods even. Right. Sometimes there are soft signs of the hormonal change, which can be something to look at. That being said, us doctors don't have that much data on which hormones specifically in perimenopause that we should be concerned about. For example, it may be that your estradiol levels are shifting into a different component like estrone, or your progesterone levels are going down, but they may still be within normal range. But because they're not your normal, your symptoms may be specific to you.
Right. So why these hormones, they keep playing soccer with us, we are like trying to dodge them, but they keep hitting at us. So how should we, what should we do? Kare kya?
The fact of the matter is hormones are a fact of life, but there are things we can do to make them perhaps more manageable. Now, what are they? Typically, it's honestly some basic things, right? Good diet. Yes. Now, processed foods, high glycemic foods, dairy, certain whey protein powders, certain supplements may worsen the hormonal milieu. So, for example, ashwagandha, it's great for certain people, but for some people it increases androgens in the system and can have more hair fall and maybe even a bit of acne. But for some people it's phenomenal, who need that component. So we have to look at everything that you're ingesting, and we have to clean up. Mm-hmm. So drink lots of water, have lots of great fruits and vegetables, have good healthy seeds. More protein is always good. It also balances your blood sugar. And at the same time, remember, your blood sugar is also associated with hormones. So this is very important when it comes to diet. Next is exercise. Exercise is phenomenal for you, as we all know. We were meant to be physically active human beings. We were meant to be moving. We were meant to be walking. We were meant to be running around. And now, clearly, that's not happening. So we're much more sedentary. So making sure you get your steps in and then adding on exercise on top of it, weightlifting, improving your muscle mass, that's important. Staying away from processed things, all that artificial colors, we have no idea, what it might be, how it might be affecting us. Right. All these things, see how you can keep life as clean as possible.
So in simple terms, it's a holistic, I think you should have a holistic attitude towards it, a 360 degree. Like you need to keep your health in check, and food especially, good food, healthy food, green vegetables, exercise, no processed food,
Yeah.
no junk.
Yeah, discipline.
How about mental health? People have mood swings.
Yeah. So mental health is obviously extremely important. Now, eating well and exercising will help contribute to improved mental health. But mood swings may also just be your natural feelings. It can also be due to hormones. It can be a mix of both. So when you're having a mood swing, how do you manage? Well, one is being aware that you're feeling moody. So then you don't have to give into it. Like, oh, I know when I'm irritable.
Generally, you don't realize it. Others who are around you realize it that you're having mood swings, right?
No, I realize it. Now I know because I'm like, oh, I'm really irritable. Why am I so irritable? And then I'll realize, oh, okay. So we can be self-aware and self-conscious of our own feelings. We can notice ourselves. That is the great part about being a human being. It's self-awareness. So you can start to notice it and not give into it. That's one. There are other things. For example, magnesium can very often help with some, for example, PMS symptoms.
Anxiety, yeah.
Yes. It can calm the nervous system. Magnesium is wonderful. Magnesium threonate or magnesium glycinate. Taking that at night, you can actually see some benefit in it. That helps.
So you are saying from perimenopause to menopause, all these symptoms are quite normal or people do get it, right? But when you can take a breather that, okay, this is over, this is going to get over and no more hormonal fluctuations. Is that going to happen ever or?
Your hormones are consistently fluctuating. That's how your body works. It's by some hormones are higher than others at some point, and then the other ones respond by being lower, and then it goes into a feedback loop. There's so many hormones, and they all respond to each other. They have their own world inside of you.
Right.
So asking your body not to be in flux is impossible. But yes, large fluctuations after perimenopause. Once you hit menopause, then you're in a more stable state, I would say.
Your body settles down, right?
Yes, that being said, as time goes on, your testosterone levels continue to decrease, your estradiol turns more and more into estrone. So you will see a certain difference in your body and how it responds and how you are as a person. But it won't be as dramatic as the perimenopausal experience.
Right. So we have seen, excessive hair fall, weight gain. Even some people get acne, in their late 40s and sometimes in their 50s, early 50s. So is that also normal or part of this perimenopause or menopause or is this again a hormonal thing?
Yes, so as your testosterone levels decrease as you're entering menopause, you'll also find that you get more, you can have more weight gains. You're getting less muscle in the system. Your muscle mass is less. You're maintaining muscle mass less. You're maintaining muscle mass less. You're maintaining less muscle mass, and your metabolism is decreasing accordingly. So you will find weight gain.
Yeah.
The hormones also may change, and when they're changing, you'll find that weight may accumulate more in your abdomen.
Yeah.
Right? Hair fall will happen as hormones change, of course. But we also have to look at certain vitamins. You may not be absorbing vitamins the same way as you did when you were 20 or 30.
Right.
Yeah.
Right.
So we have to look at a bunch of things with all of that. And acne, honestly, I find acne during perimenopause and menopause more of a newer phenomenon. That being said, it can, of course, happen, and it always probably did happen. I just feel maybe I see it more often. It could also just be that people know that they can come to a doctor now, whereas before they just ignored it.
Right. Possible.
So it could just be...
Is pigmentation also happens during menopause or...
So you can have pigmentation. You can have melasma per se happen during perimenopause or during menopause. So again, any time of large hormonal flux is when melasma can happen. Pigmentation in general is the curse of living in India in this certain
the pollution,
latitude.
Yeah.
So, and also the sun, the way the UV
sun,
rays
yeah.
hit our country, the angle of incidence. It does also impact the amount of pigmentation we get, and the longer you live, the more likely you are to get pigmentation.
And do men also go through menopause? I think women will be very happy to know that.
So men don't go through menopause, even though the word men is in it. But men do see a decrease of their testosterone levels. They will see changes in their hormones, as all human beings will. It isn't as stark as the experience of perimenopause and menopause because men don't have a period, but they do see changes for sure.
So we can also, go back and blame them, right, for any mood swings. It could be they are also hitting menopause, we can always say.
I don't know if we can blame them. We can just accept that they're also going through changes just as we are.
Yes, we are, right. And how your skin gets affected, like does it get even drier and dehydrated?
Absolutely. So as the estradiol and progesterone balance changes and the fraction of estradiol changes, you will find less resilience of your skin, less elasticity, much less collagen. You hold on to water much less as you get older. The ceramides in the skin are also decreased. So yes, during menopause and obviously perimenopause leading into menopause, your skin has all of those problems. So you will all of a sudden be like, why do I look older? Oh?
Yeah.
Why is my skin more saggy? And you'll not
right.
understand why.
The wrinkles are more visible, the crow feet is more visible, right?
Yeah, but
The
it's
frown
happening
lines,
cumulatively, and then all of a sudden it just hits you, and you're like, oh.
Yeah. So do you agree that supplements help?
Supplements help, but to what extent?
Like collagen rings and capsules and tablets and...
Collagen supplements do help. We are getting great data out of it. You have to use the right amount. You have to use at least 2 grams of collagen a day, and of animal-based collagen, not vegan. Vegan doesn't have any real data behind it. It does help. Will it reverse all of it? Absolutely not. No one can reverse the sands of time.
Yes, yeah. So the clock won't go back, right?
Yeah,
you have to accept it.
We can reduce them,
Yeah.
but we can't make you 20 years old. I wish.
Yes, we all wish that.
I would have done it for myself then.
Yes, right. And what do you think about fillers? Like, they are getting so common. So do you agree that a young girl should get a filler, or they should wait till 35 or 30 or...
I mean, I think it depends. First of all, you have to be an adult to get fillers, so let's get to you have to be an adult. You have to be of decision-making capacity. You have to know what you're doing. Honestly, everyone has the right to do what they want with their body as long as they're adults and they know what they're doing, and they know the risks and they know the benefits. That's their call. I'm not here to judge anybody. That being said, I don't think fillers should be done just to satisfy a trend. I don't think they should be done out of peer pressure. I don't think they should be done out of insecurity. So there's a balance that you have to play for yourself. And, even as a doctor, if I think someone is coming from the wrong place about it, then I usually will not recommend it.
So people, they look at celebs. Some of the faces have gone wrong. I mean, we think they have gone wrong, or maybe they are right. We are not sure about it. So what exactly happens?
So, some celebs' faces you love, right? So everyone just focuses on the celeb's face that they don't like. But okay, because as human beings, we are attracted to the worst case scenarios. Let's talk about that. The fact of the matter is, usually the cases of celebs' faces that you don't like are not something that I would do. It's something that, they may have gotten a lot of plastic surgery, so they're looking too tight. Usually, for example, if they're looking really puffy, they may have...
Puffy, swollen, yeah.
Puffy and swollen. Usually it might be fat grafting. It's not fillers.
Okay.
It might be way too much Sculptra, but it's not really hyaluronic acid-based fillers or Botox gone wrong.
Right.
Usually it's something more invasive. Right. So I think people just use the word Botox or filler as a catch-all to say, oh, it must be this, but they don't genuinely know. We also don't know if it's just maybe a complication of a procedure that they've done. Some women look extremely puffy because they're taking an enormous amount of hormones. They might have done IVF. They might be going through something, so also there's a lot of judgment of the female form.
Do you think the patients force you people, like the derma especially, that we need more on our face? Does that happen quite often?
That can happen, but many times patients clients, they don't know what they're asking for. And you can't blame them, they're not doctors. So they think that they need this line filled, for example, but they don't realize that if they fill it too much, then they'll look puffy, Or they think that all of their under eye hollow has to go, but they don't realize if they do that, they'll look too heavy or their eyes can look smaller.
Right.
So,
Agree.
So they're looking at removing the line, but not considering the overall global impact of their face as a whole. In that's my job, is to say, no, I don't recommend that. Now, after that, if somebody wants to do what they want, that's their call. But our job is to educate and explain that how to look like yourself, how to look natural, while still solving the issues you have and accepting that you will still have a little lines, you will still have a bit of under eye hollow, but you'll look better, you'll look fresher, you'll look like yourself. And that's the goal. The goal is not erasing all lines. And youth isn't lines, right? Like my daughter's 7.5, and she has a really adorable nasolabial fold. But she's not old. No one can say she's old. What's wrong with having a laugh line? That doesn't mean you're old. That's just your face.
Absolutely.
Children have that. Children have little under eye hollows. Children have lots of variations in their facial structure, and nobody goes around thinking that they're old. So us deciding that that line makes you old is incorrect.
So our face is a very complex system. So what do you think about, what's your take on these salons which are doing fillers and how scary that can be, like
I think
how damaging it can be?
I think a doctor needs to be the only person who can inject you, at least in India. In the US and Europe, there are, nurse practitioners, for example, that are trained to do it. That's a separate thing. They have training, they have education, they have registration to do that. In India, we don't have that system. So you should definitely be going to a doctor. That doctor would have studied anatomy, would know the risks of any procedure. They can also solve anything in case you have a problem.
Right.
The most important thing is that while you always hope nothing goes wrong, and usually nothing does, but that in case something does go wrong, you have somebody who knows what to do.
Correct.
And what happens with people that are unregulated, unregistered, they don't know what to do if there's a problem. You need people that know what they're doing, especially when it comes to your face. And what happens is a lot of people, they want something cheap. They want super cheap Botox. They want super cheap filler. But usually you're paying for it in something else. You're paying for it with somebody with lack of expertise. Maybe you're paying for it in other ways that you're not aware of. You're paying for it in a sense of security and safety with the person you're working with. You're paying for it. There is no free lunch.
So, Dr. Kiran, during menopause, people have very dry, tired-looking skin. What do you suggest to have a more refreshed look?
Oh, great question. So first thing first, I always recommend to increase omega-3 fatty acids in your diet, or you can have a tablespoon of flaxseed oil every day. That really helps with internal nourishment. I guess that, spoon of ghee, whatever that is, right?
It's a good
Old
idea.
School stuff.
But no side effects? Like, of course, you can put on weight if you are having ghee. Right?
Yeah, but then you have to balance it with you have to reduce other foods. You balance with exercise and also reducing, that 100 calories from somewhere else, right? That's one. The second thing is you have to change your skincare routine entirely. So gentle cleansers, nothing foaming. Even an oil-based cleanser is great. Hyaluronic acid or polyglutamic acid, great. Humectants that bind water 1,000 to 4,000 times its weight in water.
Right.
Then on top, you want really strong emollient creams. Right, so really heavy creams. And, I really believe in facial oil for a menopausal woman. As long as you're not acne prone, I think oils are actually a great add-on. They can really add benefit and suppleness and elasticity to a menopausal woman's skin. So that's a pro tip.
I think a good moisturizer in the night, a good hyaluronics, any kind of a cream which has a very good dosage of hyaluronic will help, right?
Absolutely.
So you need, I think throughout the night it should keep your skin hydrated and supple.
Absolutely. And also you're looking at not allowing water to leave the skin. So you're looking at reducing transepidermal water loss. So if you like facial oils, that's great. If you don't, oils really help with that. But you can even do slugging, right? With Vaseline petroleum jelly.
Yeah.
You can do Korean snail mucin. All of these things reduce transepidural water loss.
And I think with the air purifier and heaters and all, your skin even gets drier. I mean, it's,
absolutely.
I think you need extra care.
You do, and you should
especially thanks to the pollution.
So so a few things. So the air purifiers don't necessarily make the air drier, but the heaters make the air drier.
Yes.
So you can actually get
a humidifier.
So that really helps modify that. The other thing is, pollution doesn't just make your skin drier. It makes it more irritated. It damages the barrier. It ages it more. You get more pigmentation. You get more acne. You name it, pollution does it. Plus, it can also enter into the bloodstream through the skin.
Right.
So pollution is evil.
Yeah. So Dr. Kiran suggests us some treatments. In-clinic treatments which can make your skin looking more youthful and fresh and supple.
Oh, great question. So there are a few things you can do. When we're looking at, for example, hydration, we can always do silk dermal infusion where you hydrate skin through an infusion process through the skin. You can do also microneedling. You can microneedle in hydration particles. So you get it to the second layer of the skin. It depends on the depth. You may want to go to the dermal epidermal junction at 0.5, 0.6 depth. You may want to go stain the epidermis. You may want to go deeper. Depending on the depth that we're looking at, we typically can hydrate and get more into the deeper levels on the skin, as opposed to when we apply things topically where you get very little absorption. The other thing we can do is we can inject hydrating molecules in. So we do boosters where you can inject hyaluronic acid in, and you can do it more superficially, or you can do deeper hydration as well.
So skin boosters and fillers are similar?
No. So while they're both made of hyaluronic acid, fillers are cross-linked and modulated in a way to do different things. So fillers can, volumize your lip, or they can add structure to your lip, or you can actually have different fillers that will lift your face. There's a G prime component which discusses its lifting capacity. And then there are some that volumize, they might be the ones that you want to do your cheek fillers with. Temple fillers, things that really increase the volume. There's some that volumize and lift. So use them as your art tools, right? There's a canvas, and then you get to choose the tool with which you paint. Fillers are like that.
So lip fillers are like, sometimes, they look like ducks, so
it depends on how you do it. Like my lips, it depends on how you do it. So my lips are filled, but you would never guess that they're filled. And I like a more natural look. I don't like duck lips, and you don't have to do duck lips if that's not what you want. Yeah, it's not required. It's not that all lip fillers.
So is it a trend
lips.
or things? It's like filler gone wrong.
I mean, it's part of it is a trend. It's not really filler gone wrong. If you want a duck lip, it can be done. If you don't want a duck lip, don't do a duck lip. Yeah. Some people want it. There are some cities around the world that love duck lips. Like that's Dubai. Their look, they feel like they've gotten a lip done once they get that lip. Yes. But that's not my aesthetic per se, so I prefer not to do that.
Right. And what is the downtime of a microneedling procedure like?
Microneedling is very low downtime. Normal microneedling has just like a day or two of a little bit of redness. When you do things like microneedle RF, the downtime can be longer. That's where you add energy to your microneedling. There you get more results though. So very often we do transition people upwards to microneedle RF for stronger results. But the downtime again is not that bad. A few days, little scabs, little redness usually. And that's about it.
And how to get rid of lip pigmentation like?
So lip pigmentation is caused by different things. For some people, it's genetic. It is just naturally that pigmented.
Oh, okay.
For some people, it is cumulative sun exposure. For some people, they may be allergic to their lipsticks and they don't even know, or the products that they're using.
Possible.
For some people, it's smoking. For some people, it's pollution. For some people, it's repetitive eczema, or maybe they lick their lips a lot. They, rub their lips a lot. It's a multifactorial thing. So first we look at the cause. If you're smoking, stop smoking. If you have dry and irritated lips, treat that. If your lipstick is causing you an allergy, change your lipstick, change your toothpaste. All these things first we look at. We work at the cause first. And then treatments happen only once the cause is gone, right? Or you're working at the cause. Some things you can't do much about. Then you can look at treating it anyway, but you moderate the cause. But some things you can. Like if you have eczema and I treat your eczema, now I'm no longer causing the pigment, so treating the pigment becomes much easier. So then you look at treating the pigment. Then you can microneedle. You can do lasers. We love PicoSure here for lips. The results are phenomenal, really significant. Some people do microblading of the lips, so you can you can tattoo color in that's semi-permanent.
Of course, yeah.
Yes, you can semi-permanent makeup on your lips, and then they look nice, and it lasts a few years. So a lot of people like that too. Some people just don't have the patience to work on it and remove it. And that's okay, sometimes your wedding is coming up, or, like you need it gone and you don't have 6 months. That happens. Then you can, for the interim time period,
I've heard of this permanent smile also on face.
I don't know what permanent smile is. That sounds alarming. That sounds very Batman, Batman and Joker.
So I was just wondering, if your friend is in a bad mood and you have that permanent smile on the face, how are you going to fix it?
I somehow feel like we're we need to find out what this permanent smile is, because I doubt anybody would recommend someone who is permanently frozen in a smile. Like, that just sounds crazy, you know? Yeah. So I don't think that's that. I think we have to figure out what we're talking about.
So I've seen these Chinese on Instagram. So they just give you an expression where you are smiling. So what's your take on this social media trends and fads? They keep coming, you know?
The problem is that trends and fads are very exciting and they can sweep you away, but they might not be right for you.
Right.
So I think everybody needs to learn critical thinking, which is this right for me? Does it make sense just because it's a fad? Do I need to do it? Like, do 12-year-olds need a 12-step skincare routine? No. You know, like they do not, right? Like lots of things are there that are completely irrational. How many out of 10 trends, 9 make no sense? You know, so you really have to figure out, is the trend for you? What is the trend about? Who's benefiting from this trend? You know, like, think critically about what's coming at you.
Right. Agree. So, Dr. Kiran, do you believe in this gua sha or, face rollers? So many things are there right now. Derma rollers. People are, just watching these reels and doing it at home. So, is it going to make them look younger? Face yoga and all?
So, let's go one by one. So, home derma roller, if you do it correctly in the right timeline, perfectly, you know when your skin is getting too irritated, you're using the right depth. Could it help you? Yeah, a little bit. But let me tell you, 99 out of 100 people will not do it right. They'll get too aggressive. They may use too high depth. They'll do it too often. They won't think about it logically because they're not doctors, and they're only looking at their emotion that I want my skin to be better, so maybe I have to do more.
So
you know?
Yeah.
Maybe I should do it every day. I'll get better. You can't look at it, logically when you're working on yourself. Even as a doctor, right? We try not to go to ourselves to treat ourselves. You typically want to go to somebody else. You want an unbiased opinion.
Right.
Because you will always be the most biased person to yourself. So, you may feel some pain and you may think that's needed. Whereas, for example, if I were to do derma roller on somebody, I would want to mitigate pain. So these are reasons why nobody should really end up doing these things at home, because if you do it wrong, you can end up with a problem. You can have a bad infection and end up with scarring. You can have something called tram track scarring, which is very hard to treat, where you get raised lines like little tracks on your face. You can get irritation. You can get long-standing sensitivity. The product that you actually microneedle in may not suit you. You can get bad rashes for extended periods of time. There's the risk is not worth the benefit, because if you're doing it at home regularly at the depths that are available, which is low depths, around 0.2 to 0.3, you're not getting that much benefit, but you're taking all the risk.
Absolutely.
So to my mind, why take all the risk with negligible benefit?
I think it's a feel-good factor that you are doing something for yourself, and
you feel like it is, but why can't we do something for ourselves that's better, like exercise, or like drink more water, But like rubbing our face with a face roller, that seems to be the solution.
And how about gua sha?
So gua sha is not a bad thing. Again, it helps with lymphatic drainage. It helps, with water retention, can help you reduce it. The problem is when people do it wrong. Like if you have acne and you're doing gua sha, likely your acne will worsen. Some people go too hard. They break their blood vessels. They can inflame and irritate their skin. So as long as you're doing it gently, it's not a problem and you're not acne prone. I don't mind you doing it. Are you going to get a huge improvement? Probably not. Now, moving on to face yoga, again, you have to do it correctly. So many people, they do it wrong. Like, what are we looking for with face yoga? We're looking to uplift the face, right? So that means you have to work more on the elevator muscles. So that would be the frontalis muscles, the zygomaticus, these muscles that lift the face. But when you're doing face yoga, maybe you use the depressors, maybe you use more platysma, or, you're using the muscles that bring you down more. So how do you know what muscles you're using or activating? You're going to make the facial motion like you think you're doing it, but you have to use all the muscles. You can't only localize on the elevators when you're using your face, right? You have to use both the components of musculature. That, and then to do face yoga and you do it correctly, you need years.
Yes, of course.
You need years to make it well. Like, for example, if I start weightlifting today, I'm not going to see much results for at least a year or two, right?
Absolutely.
And that's on my body, which are big muscles. Smaller muscles take longer.
I think the best face yoga is frown less and laugh more. Right?
Yeah, well, that's a cute way to put it. That's a way to live life. That's a motto.
Yeah. I agree.
That's a motto. But you laugh more, you'll get more wrinkles around your mouth. But I don't think that's the point. Like, so what? You get the laugh lines. It's part of life. It's no big deal.
Absolutely.
So face yoga, if you're looking at it to uplift it, as long as your thought process is, okay, I'm doing it, but I don't have huge expectations, by all means do it. It can't hurt you per se unless you're doing it really, really wrong and focusing too much on the depressor muscles. But how much is it going to help you? So I always look at the cost-benefit analysis. If it's taking an hour of my day but giving me 5% benefit after 3 years, I don't think it's worth it.
Absolutely. I agree on that.
So I'd rather look at things that give me more bang for my buck. And for me, my buck is my time. Like, there's nothing more valuable than my time.
Got it. What's your take on exosomes?
Interesting. So I have a thing with exosomes. I think they're interesting. I think they're great additives to treatments. For example, if you're already treating hair with PRP and you add on an exosomal treatment, that's interesting, But I also think you should be cautious. For example, exosomes right now, you can get a few different types. You can get umbilical exosomes, which are from the umbilical cords of babies. Now, you have to make sure that they're tested. In the U.S., when you get exosomes, you get a full report that it's tested for HIV, hepatitis C, hepatitis B. You get that report.
That's quite a risky thing, actually.
Yeah, and you can trust it, right? You're getting it in the U.S., you're getting it from U.S. umbilical cords. So there's that. In India, the source of that, I think, I'm not sure about. So I personally don't use human-derived exosomes.
So we have launched a topical application, which is plant-derived.
Exactly. So there are more plant-derived exosomes, which are more interesting.
More safer.
Yeah, they're safer. They're less risky. And they're also interesting for additional benefits. Again, we don't have enough data to anyway say exosomes are better than the previous treatments. For example, there's no data to say an exosome is better than PRP. So I'm going to stick with PRP because I know it works. I've seen it work. I continue to see it work. Whereas exosomes are new on the field, and there isn't that much data behind it. Can we show? We do have good case reports, so can we use it as an addition? Absolutely. But is it your gold standard of care? No.
Yeah.
You stick with the stuff that you know works, has the most likely benefit to you, the highest benefit to you. And after that, if you want more, then you add things on. So you always have to have a clear way of thinking. First, you do the thing that has the most benefit. Then you add on the stuff that, can help. But you don't just do the thing that can help and then consider later on if you want to do the thing with the most benefit.
We are looking at people who are actually scared of any invasive treatment and people who have got fillers or Botox done and they want to maintain it for a longer period of time. That's the idea.
Yeah, but for example, you can add an vegetarian exosomal product, but you don't forget your retinol. First retinol.
Yes.
You get my point?
Yeah.
You do the retinol and then you add your exosomes, but you don't do the exosomes first.
So thank you so much, Dr. Kiran. It was wonderful talking to you, especially on perimenopause and menopause. I think many women would like to know more about it because there's so much of confusion everywhere. So it was great talking to you. So we'll be talking on more interesting topics in our next episode.